your blood pressure, your blood sugar, and your blood cholesterol are at least largely in part due to your diet and your fitness and your stress and your sleep. So there have been estimates, and it's over and over. That's what's so frustrating, is 85% of heart attacks could be prevented. 85%. Just, the best protection may not be a mask, gloves, and vaccine. We may need them, but it may not. The best protection may be a salad and gym shoes and quitting smoking and, getting sleep. My friend, and maybe yours, Mark Hyman, always says health doesn't happen in the doctor's clinic. Health happens in the grocery store and the produce department, the farmer's market, and with your friends. And I believe that completely, is what happens in medical care. Doctors' offices and hospitals determines 11% of your health. Your environment, your genetics, your epigenetics, your social situation is the other 89%. Fascinating to really see, real thought leaders come up with that data.
Dr. Joel Kahn, thank you for joining me today to talk all about cardiology. I have been really looking forward to this conversation with you because I feel like in the field of cardiology, and I'm sure we're going to get into this in our discussion, there is so much you can do from a preventative aspect in terms of modifiable risk factors when it comes to someone's risk for cardiovascular disease. So I'm really excited about this conversation today. And I just wanted to open it up for my audience, for those that don't know you. Give us a little bit of background about yourself and how you got into the field of cardiology.
Sure, and kind of you. Just to answer that last little part, 61 years ago, I'm in suburban Detroit. I'm in my clinic, the Kahn Center, but I was born about 2 miles away. Real exciting life. I've gravitated 2 miles and it didn't end up to Southern California. But I had a heart murmur, started seeing pediatric cardiologists. Nothing ever happened, didn't need to have surgery. But I just was around cool machines, cool noises, cool doctors. That's a true story. And I got very interested in it. No doctors in my family. So, 9 years old, what do you want to be when you grow up? I'd say I want to be a heart doctor. And just kind of stuck with that. It's been a pretty good run, a pretty good gig. I went to University of Michigan undergrad med school, did grab the summa cum laude banner as I walked out of med school, which is kind of fun. Internal medicine, cardiology in Dallas, cardiology in Kansas City. And since 1990, just to wrap it up, I really developed as a heart attack specialist. I could put a balloon, a stent anywhere, 3 a.m, crazy, wonderful life. Truly honored to probably literally save, hundreds, maybe more people's lives in the midst of real tragedy. But I just got very interested in prevention. And I just kind of did both for most of my career. And nutrition was the entry point for me. I got very interested in nutrition. But that led to some formal training in mind, body, and stress and supplements and the environment and biotoxins and on and on. So a few years ago, I hung up the rushing in at 3 a.m. and really focus on prevention. As you said in your intro, we'll talk about it. This thing, heart disease right now is not the most common topic. It's the pandemic and all, but it never goes away. It's constantly, destroying families and lives and careers and robbing us of some loved people. And it is largely a preventable disease. And it's not fantasy. We've had the skills to prevent heart disease for decades. We just haven't made it a priority in this country, sadly.
Absolutely. I hear you there. And, I think the last time I looked from the World Health Organization, cardiovascular disease was still the leading cause of death worldwide. I think it's still ahead of cancer. But, it's one of those things that plagues so many people and it's very prevalent. And so I think everybody knows somebody that may have dealt with some type of cardiovascular event, whether that's an MI or a stroke. And for those that don't know what a stroke is, that is where there's an occlusion typically. So you get no blood flow to the brain. As opposed to a cardiovascular event where you get a blockage of blood flow to the heart and those coronary arteries that feed the heart. And so there's a lot of different things, as you mentioned, in terms of lifestyle factors. But I just wanted you to talk a little bit too about why is it so prevalent? I know, there's all these different things out there like diabetes and obesity, and you just kind of look at our healthcare at large and the health of our country here in the United States. Can you speak a little bit to that and kind of how this is setting the stage for so much cardiovascular disease prevalence?
Yeah, maybe in about 2 minutes, history of cardiology. That actually after World War II, there was a increasing diagnosis for heart attack, many of which were fatal. And very quickly, some dollars got put into the question, Why is this happening? So in Minneapolis, outside of Boston, called Framingham, we got some federal research dollars to start doing studies. Up to that point, people would say heart disease was aging. Heart disease was a process of the fact that our lifespan was rapidly increasing, and we just wore out. That's why in the early 60s, we came up with the big 5 list we still use 50, 60 years later: smoking, diabetes, high blood pressure, high cholesterol. And does mom, dad, brother, or sister have an early heart attack, early stroke, like at 45, 50, 55? The 5 big risk factors. And we use those to this day. Go online and put them in a calculator. You maybe throw in your cholesterol level, and you can come up with, what's my personal risk? I feel fine. And that is probably the key point you made, and I want to make. This is a sneaky, slow disease. This isn't a car accident, boom, you got heart disease. You've had heart disease for 10, 15, 20 years the day you present with chest pain, or you hopefully not a cardiac arrest or a heart attack or a stroke. It's been going on a long time. It's an asymptomatic snake in the bush, and it strikes one day. But we learned that those big 5 things you can predict, but you think about those big 5 things. And this was a breakthrough about 20 years ago. I mean, are they inevitable and genetic, or are they controllable? Well, whether you smoke or not may be a devil of a thing to quit, but it's controllable. Your blood pressure, your blood sugar, and your blood cholesterol are at least largely in part due to your diet and your fitness and your stress and your sleep. So there have been estimates, and it's over and over. That's what's so frustrating, is 85% of heart attacks could be prevented. 85%. Just a hospital coronary care unit, a hospital cath lab, the hospital surgical suite. 85% of people lined up to have those procedures or having those events are dying. With adequate education, could design a lifestyle. And it turns out the lifestyle also helps prevent diabetes, cancer, dementia, autoimmune disease. It's pretty much the same prescription. But, right here in the middle of the pandemic, how many health experts are saying at least part of the problem that the United States has got a third of all cases of the coronavirus right now is our deteriorating health. And if we, take this lesson and use it to educate the public that, the best protection may not be a mask, gloves, and vaccine. We may need them, but the best protection may be a salad and gym shoes and quitting smoking and, getting sleep. We'd be better human beings and stronger human beings. It's, that functional medicine is, this is the name of your Instagram account very appropriately, but the word functional, that, we really are one network of intertwined systems. I'm a heart doctor, there's a kidney doctor, there's a lung doctor. What benefits one system benefits them all. So, your listeners, my listeners, we just need to get some credible facts and implement. It's a slow, silent disease. Don't assume, because you're 30 or 28 or 35 that you don't have the beginnings of this process. Autopsy studies in Korean veterans that died in trauma, Vietnam veterans, show in some cases unbelievably high rates in 22-year-olds of plaque in arteries. Scary numbers with the American diet, the Western diet.
Yeah, so I definitely want to jump into that more and discuss, what are some of these risk factors? I mean, we talked about the smoking, we talked about, the sedentary lifestyle and diet and stuff like that. But I did just want to touch on one thing too. And I think that's an important message that you brought up. It's that empowerment piece, that we really do have control of a lot of this. And it's this important aspect of epigenetics. So all those different environmental factors that influence our genetic expression. So even if we do have that family predisposition, it doesn't necessarily mean that we are doomed and that is going to necessarily be our fate or our destiny. And so for some people, it may require more rigorous interventions, whether that's, pharmacotherapy or not, and we'll get into that in a little bit. But, I think people realizing that they really have control of that and that there's so much that you can do to prevent cardiovascular disease. And so, I wanted to touch base on the risk factors again and kind of go into that a little bit more.
Sure.
And then there was
I would suggest, what I would suggest everybody do is, get, number one, get a home blood pressure cuff. Very basic. You hear almost nobody mentioned that. In fact, just a few days ago was World Hypertension Day. Hypertension, high blood pressure, is the number one cause of death in the world. 11 million people a year die related to high blood pressure. Maybe high blood pressure heart attack, high blood pressure stroke, high blood pressure aneurysm, high blood pressure leg circulation and the loss of a leg and gangrene and all. Without a home blood pressure cuff, and there is such a high incidence of blood pressure amongst 20, 30, 40-year-olds, it's the diet, it's the sleep, it's the stress, maybe it's Wi-Fi. It is clearly water purity, air pollution, the environmental epigenetic stress that, there's always been issues like that, but they are more prevalent, air pollution for sure. Get a home blood pressure cuff, get a scale. I mean, get real about some of these numbers. Then you need good blood work because you can't just measure. You need that cholesterol panel, we call it a lipid panel, but you might want to ask, there's something called an advanced lipid panel, your particle size, your particle number. I want everybody to get a kind of cholesterol check called lipoprotein little a. Most bizarre thing to say, lipoprotein little a. I mean, it's actually lowercase a. It's a kind of cholesterol that was identified in 1963. It never shows up on your blood work if you go to your doctor for routine checkup or even the emergency room. You can be admitted for a heart attack and a bypass. They won't check it. About $25 blood test. It's the most common genetic inherited cholesterol disorder. And it can lead you at age 5, 10, 15, 20, 30, 40 to start to develop damage to your arteries because it's genetic. It's not influenced, sadly, by diet, fitness, and most of the pharmacotherapy that you mentioned. It's just coming into the common language to start talking about one of the missed, you hear about somebody that had a heart attack and a stent at age 48, but my doctor told me all my labs are great. This is the single biggest unordered test that explains that. So everybody, your age, Tyler, I'm probably twice your age, everybody should have it checked once. If it's normal, you never need to check it again because you've either inherited it and it's high or you haven't and you're normal. And if you're high, it's a kick in the butt to say what you just said. I inherited a risk for arterial damage, but I can control my fitness, my diet, my sleep, my environment. And that is profound. That does bring down the risk tremendously. Homocysteine, another simple, inexpensive test, represents methylation in your B vitamin intake. It's not as common as lipoprotein A to be seriously elevated, but it can damage arteries. We call it endothelial function. I want to know your vitamin D level. Might want to check your thyroid status once. I actually am amazed at two nutrients that I've only started to check the last couple of years. Pretty simply and not very expensive, an omega-3 blood level. You can have your doctor check that. It's a nutrient that humans don't make, but critically important for brain function, membrane function, triglyceride, blood sugar levels and all. And it's just shocking how deficient people are. If you're eating a lot of salmon, the odds are you probably aren't, or taking a large dose of fish oil. If you're eating a lot of chia, flax, hemp kind of foods, you're probably not. I'd say at least half of my patients are severely deficient in omega-3. And some of them with joint autoimmune inflammatory disorders get tremendously better by bumping their omega-3 intake. So they'll actually, when you get somebody to feel better, they're much more bought into the whole process.
Absolutely.
Lastly, just recently, I started checking blood iodine levels. Iodine is very important for adequate thyroid function, but it's also important for cardiac function, breast health, prostate health. And it's a simple, inexpensive blood test. We used to get iodine from Morton's iodinized salt, but lots of people have cut back, and maybe you're using Himalayan or Celtic salt, and there is some iodine there. But a lot of people are salt phobic, which isn't necessarily a bad choice if you're struggling with your blood pressure. Seaweed, kelp, wakame kind of foods are rich in iodine, but you might want to check it. And I've seen some people just really feel better with either eating foods that are a little bit more rich in iodine, or there are drops, Lugol's iodine and other drops you can take. You don't want to overdo it. It's one of those vitamins like vitamin D. Some may be good, doesn't mean 10 times more than some is a good idea.
Yeah. It's a Goldilocks thing.
And, that would take you way down the path. If you know your advanced lipid profile, your homocysteine, I'll mention one more, your vitamin D. You do want to get an idea if you're living a life of inflammation or anti-inflammation, a concept that's been in the science for a long time. Probably Dr. Andrew Weil at University of Arizona started talking about anti-inflammatory diets free of added sugar, processed foods, poor quality industrial oils and all. There's a blood test, your high sensitivity C-reactive protein. And if you've got poor dental health, if you sleep poorly at night with sleep apnea, if you've got a big waistline, if you have psoriasis, if you're very deficient in omega-3 and vitamin D, your high sensitivity C-reactive protein indicates that you're inflamed, and maybe even your blood vessels are inflamed. And you really want to dig into why that's the case and what you can do about it through food and lifestyle and cleaning up all paths. So that's a little bit more than most people are getting at routine visits, but they're all available, whether it's Quest or LabCorp or your local hospital or, most of your primary care doctors. You can send off to WellnessFX or lifeextension.com, one of the self-serve labs. And the last thing, just shut it down, is, we can talk about going into hormone evaluations, but most people don't need to do that right now. There was a suggestion about 15 years ago, before we hand somebody a prescription for cholesterol medicine, Tyler, your cholesterol is 248, can't tolerate it, here's your Lipitor. Number one, give them some advice on lifestyle and fitness and, cutting out processed food and putting in whole foods. But maybe we should look at the arteries themselves. And if, Tyler, you've got a little plaque in your carotid arteries by doing an ultrasound, or you have a little calcium in your heart arteries by doing a very inexpensive, quick CT scan called a coronary artery calcium score, we may have to really ramp up your therapy, and maybe moving to prescription drugs in 3 to 6 months may be justified. But if your arteries are pristine, we don't give chemotherapy to people that don't have cancer. We shouldn't be giving statin chemotherapy to people with perfect arteries. So you can know your artery health by a ultrasound of the carotid and a CT scan. And I wasn't going to go down there. There's this fascinating study going on in Madrid of 4,000 healthy bank workers. They're 40 years old. They just volunteered to be in a prospective study. And they're all getting ultrasounds of their carotid, their groin artery femoral, and a CT scan of their heart about every 5 years. And these are just healthy 40-year-olds. The incidence, the rate of plaque is about 40%. And when they just did the first follow-up, it's going up a lot. So if you think, well, I'll get to this when I'm 50, 55, coronary artery disease and the risk of future heart attack, stroke, erectile dysfunction, peripheral arterial disease, that's beginning in your 30s, maybe even in your 20s, and it's measurable. And then just jump on in and let's just change the lifestyle, and let's change the triggers that are causing that to happen.
Yeah, I love that. And how you really bring into account, like, you're using all forms of medicine. You're bringing in the lifestyle-based medicine and a lot of the nutrition and kind of like kitchen medicine stuff that I'd like to say. You're using the nutraceuticals, but you're not afraid to use the pharmaceuticals if it's necessary. So it's meeting the patient where they're at, and kind of taking that into context. And, what I think is, really important too, is what you mentioned, is that there's this concept of inflammation. And so I did want to talk a little bit more about that inflammation, homocysteine, lipoprotein A, you think about C-reactive protein. So more inflammation, more oxidative stress. What is happening when you talk about endothelial dysfunction and that inflammation that's driving more of this cardiovascular disease risk?
Yeah, it's a very high level and exciting question to entertain. And I don't know if, my patients hear a lot about endothelium and nitric oxide as the first injury that happens years before you can even measure plaque in the arteries. But, 50,000 miles of arteries in the body, 50,000 miles that feed the brain, the legs, the kidneys, the sex organs, certainly the heart and such. They're all lined with a single layer that's called the endothelium. It was felt to be just a barrier. Here's your blood cells. Here's the little wallpaper wall. And that's simply all it did until the 80s, when we started finding that these are actually very active cells. The endothelial layer is an active hormonal organ. In fact, if you were to strip out all those little cells, they say it would fill 6 or 7 tennis courts. It'd be a enormous organ in the body. One of the key things is for those endothelial cells to continually make a lot of nitric oxide, NO, simplest gas in the world, nitrogen and oxygen. The arteries make it, and immediately it protects the arteries. It's a very cool kind of cycle. It protects arteries from plaque, protects arteries from being constricted and causing high blood pressure, protects arteries from developing clots, which are all the mechanism of ultimately having these events. And if you go on long enough, so what causes arteries to have endothelial dysfunction, or ED? Smoking, high saturated fat diets, go get yourself a Whopper, fries, and a shake. You'll have endothelial dysfunction in 1 hour. That's has been done in healthy human volunteers that are age 20. If you have that same meal over and over and over, you're going to have constant endothelial damage. Never exercise. Let your blood pressure go at 170 without getting checked, or your blood sugar at 170 without getting checked and modified. So you're absolutely right. And then the arteries get inflamed, and you've used the word inflammation. There's injury. It doesn't heal. White cells come in, macrophages come in. We start to release cytokines, a word that a lot of people are hearing nowadays, and inflammatory mediators. So I know you're on top of this stuff. This is what medical students learn in school, but it's all actionable today. It's been actionable for years. That your doctor can order a lab panel. I have no stock in a lab company, but labs like Cleveland Heart Lab, which is now owned by Quest, or Boston Heart Lab, or there's one called Salvio. I can order 5 different tests of inflammation markers from high sensitivity C-reactive protein, the one called myeloperoxidase, or MPO, patented by the Cleveland Clinic, or the LPPLA2 enzyme. That these are actually markers or enzymes that damaged arteries release into the blood at elevated levels, which should scare the heck out of people. You're telling me my arteries are like a pimple. That's really the analogy. I've got pimples on my arteries. Not that acne is anything I'm making fun of, but think about that internally, not externally. And, the fact that literally we do think that heart attacks and strokes are the arteries suddenly erupting in just a volcano of inflammation. You can get a heads up. That's what this message is that you have and I have. Don't wait. I say all the time, test, not guess. Don't assume there's no inflammation. Now, of course, you may feel your joints and things, but not always. It may all be internal vascular inflammation. So absolutely. We talk about there's
just one other thing I want to say too, just for people to be aware of, is like you talked about how heart disease can be a silent killer because it builds up over years and years, and then it will finally hit you. And so you have to have like 70% occlusion to actually have angina in the hearts. Is that right? I think like 70% occlusion to actually experience angina. But inflammation, a lot of people think about pain, redness, swelling, inflammation, but they may not actually experience those symptoms. So what else would they maybe be looking for other than doing some of those lab markers? Is there something like symptomatically that people would experience?
Well, it's a great question. And, I can't help but give you a compliment. Somebody looks at your Instagram account and says, man, he has all those people following him. I wish I had that. And I know you've been working on that for year after year after year, all the hours that it takes. That is an analogy to compliment you, but also to say, it's day after day, week after week, month after month of endothelial dysfunction, of inflammation. And there's that other term, oxidative stress, pollution, smoking, poor sleep, and we're never eating a green leafy vegetable or a red bell pepper or an orange or a purple eggplant, things that are naturally, just supercharged, and acai berry, if you want to get into some of the fancier ones, kiwis and such. You need that antioxidant balance. So if you don't want to wait to the symptoms of clogged arteries, symptoms like erectile dysfunction. 40% of men at age 40 have erectile dysfunction. Some of it's psychogenic, some of it's structural issues. Most of it is vascular. It's the earliest sign of blood vessels that's a symptom. Can't get it up anymore. You should be very concerned that your arteries are suffering endothelial dysfunction, vascular inflammation. Get all these blood tests. Ask yourself, get a blood pressure cuff, get a scale, and get some of these advanced testing. You don't want to wait till you're having angina, chest pressure. I go to the gym and I feel this kind of uncomfortable squeezing, and if I sit down for 2 minutes, I catch my breath, I feel better. That's like an end stage symptom. We're all talking about trying to find this upstream. There are some really funky findings other than erectile dysfunction, which obviously only pertains to men, and heart disease is a female and male. All genders can get heart disease. There's an unusual earlobe crease. It's called the diagonal earlobe crease. A internal medicine doctor in New York City in 1955 or 58 published a paper. When I see one of my heart patients, I can't help but notice they have a deep crease. Anybody pull up a picture of Steven Spielberg, you'll see he has a very famous deep diagonal earlobe crease. He published, I think it's a marker of clogged heart arteries. That has been verified in the last decade, about 70% accurate. Don't freak out if you look and you see it. And a lot of women with heavy earrings, it's hard to tell, but it is there. Prematurely gray, prematurely, you have a nice dark head, and I'm over 60 and I still got pepper, salt and pepper. But if you're white at 40, you might wonder about that antioxidant status you have. Premature balding has all been mentioned. These are seriously external markers of internal cardiovascular imbalance in some people. Again, don't freak out, just get checked and all. Beyond that, it's an absolutely silent disease unless you do the carotid ultrasound or unless you do the CT scan that takes a couple minutes at Cedars-Sinai or Good Sam or UCLA or any other hospital like that around the country.
So those lab tests that you referred to, are you typically doing those with your patients in general as a screening, a general screening for cardiovascular disease risk? Or when are you going into that? Is this for people that are more higher risk when you actually take in a full history and you consider the individual? Or
yeah, if I were in charge of the world, I would have everybody get about 5 or 6 of these. And the younger, the better. What I'm most fascinated by, I'll have a 48-year-old patient that their brother just had a heart attack. And yes, I'm going to put them through all these lab tests. But they'll drag in their 17 and 18-year-old kids once I get their labs back. And I'm finding, unbelievable imbalances in vitamin D and homocysteine and omega-3 and inflammation. I mean, I don't invite pediatric patients. I'm an adult physician, and 17, 18 is certainly on the border. But man, anytime you can start to identify a problem and rectify it early. So, some of these kids now, they're eating different. They're taking vitamin D. They're on a B complex for a very high homocysteine. It's actually one of the most amazing things. It might be a parent with a high level of lipoprotein little a, and there's a chance they gave that to their child, and there isn't a single therapy right now, but it might properly explain to a young person. You just need to work a little harder at your diet and your fitness, and there'll be new therapy. I'm not into scaring people. I think, anybody listening to this interview, which is your audiences are much more sophisticated than average, everybody should get these 5, 6, 7 extra blood tests and really get a little better handle on, what's going on. Vitamin D, C-reactive protein, omega-3, homocysteine, lipoprotein little a, maybe an advanced cholesterol panel.
Amazing. And I think that's so important, again, kind of talking that empowerment aspect, that there is more that you can do, and putting that power into the patient's hands to kind of take self-responsibility for their health. And so,
I mean, my friend, and maybe yours, Mark Hyman, always says health doesn't happen in a doctor's clinic. Health happens in the grocery store and the produce department, the farmer's market, and with your friends. And I believe that completely. Very famous chart out there of how we enhance health around the world. 11% of really well thought out graph is what happens in medical care. Doctors' offices and hospitals determines 11% of your health. Your environment, your genetics, your epigenetics, your social situation is the other 89%. Fascinating to really see, real thought leaders come up with that data.
Amazing. So when you talk about, the environmental factors, lifestyle factors, totally transitioning gears. I mean, you've talked about inflammation earlier. We talked about oxidative stress. So oxidative stress causing damage and inflammation where these arteries almost callous in response to this irritant, which can lead to plaque buildup. But you mentioned antioxidants coming from fruits, vegetables, and plants being very important to help squelch up some of that oxidative stress and kind of prevent that arterial wall damage. So I just wanted to get into a little bit more, let's talk about what are some of those foundational pillars. You already alluded to some of these earlier, and starting with diet, like you said, antioxidants. Why antioxidants? And a little bit more of how should people be structuring their diets?
Yeah, there's, as you are well aware, there is so much discourse and discord over the issue of nutrition and optimal diet, from 100% plant diet to 100% meat diet to paleo, keto, and every variation Whole30. I mean, I'm a consensus builder. And even though I personally, your audience may or may not know, have eaten strictly plant-based for 43 years. At age 18, I stopped eating all plant foods. I'm still alive and free of medication and pretty darn healthy. But I'm very flexible with my patients. If they're very sick heart patients, I'm probably going to go down that path and tell them about Dr. Ornish and Dr. Esselstyn and Dr. Furman and Mr. Nathan Pritikin. But I know that doesn't appeal to the broad mass, and I'm going to get a plant-forward diet. So Harvard
Absolutely.
School of Public Health, 2000, anybody goes online, Harvard School of Public Health Food Plate, 2011. It's just a big, beautiful drawing of a plate that's half full of fruits and vegetables, a quarter, some kind of grain, could be gluten-free or gluten-containing grain, like 100% whole wheat. Quarter your plate protein, but not bacon, hot dogs, salami, pepperoni. Big glass of clean water, not necessarily dairy. And a person running and a person holding a glass of wine. It's kind of like the classic optimal Mediterranean diet food plate, Harvard School of Public Health. And everybody since then, like the country of Australia published an optimal food plate. The country of Canada published an optimal food. They've all basically patterned themselves after that since. It's a really logical compromise. Now, are there a few people in the world that are reporting on a carnivore diet that they're improving some sort of medical issue? There are. Are there well done randomized studies using 100% plant-based diets reporting medical improvements? And I stress, they're actually in the scientific literature and are very often actually reimbursed by insurance companies. They're a little better grounded than this current fad out there. There are, but that's not what most people should be striving for. They should just look up Harvard School of Public Health. I mean, your Instagram pictures, lots of brightly colored, because there's 65 times more antioxidants in the worst plant food, romaine lettuce or something like that, let alone getting into kales and bok choys and Brussels sprouts. There's 65 times more antioxidants in plant brightly colored foods. That rainbow you want on your plate, and really what you put next to it is less important. Because I just recorded a quick little podcast I do every week. If you feed a person a high saturated fat meal, you can measure a brief deterioration in artery function, insulin resistance, and as of a couple of weeks ago, actually cognitive function for 4 or 5 hours after a meal, just loaded with animal-based saturated fat. If you
Can you just elaborate a little bit more on that and kind of what is happening with the stiffening of the arteries transiently after a meal like that?
What probably happens first is food gets in your intestines. It disrupts the microbiome. It turns out, apparently, our microbiome doesn't love high saturated fat meals. It happens to include very coconut oil-rich meals. According to these are scientific studies, these bacteria have a toxin called endotoxin. It can go across the gut barrier very rapidly. So within 30 or 60 minutes of a high saturated fat meal, this blood level of a bacterial toxin, endotoxin, goes up, and that can stun arteries for 4 or 5 hours. If you do formal testing of their arteries to their arm, they won't function normally for 4 or 5 hours. If you measure insulin resistance, you'll see it go up for 4 or 5 hours. And just recently, in a study done out of Ohio State University, they took 51 women and gave half of them, actually they gave all of them one day a high saturated fat meal that mimicked a Burger King Whopper and fries. Mm-hmm. And 4 weeks later, they gave them, interestingly, a meal just as fat, but it was a vegetable oil-based meal, no animal saturated fat. And the difference in cognitive function and endotoxin in the blood was very different. It was their cognitive function on formal psychological testing went down for a few hours as their endotoxin went up. So, you can screw up a meal here and there, but you don't want to over and over, eat processed food that's going to be naturally rich and necessarily heavy butter, heavy lard, heavy.
It's what you're eating most of the time in general, thinking of context of what are you eating in a week as opposed to that one meal. And so I think just to summarize what you're saying, you're talking about how in the context of a high saturated fat meal, it's going to help facilitate this translocation of these lipopolysaccharides, these endotoxins from the gut across the gut membrane, and it can lead to this acute mediated inflammatory response that leads to impaired blood flow.
Yeah, absolutely. There's a cool little term that's rarely used, metabolic endotoxemia. Food releases endotoxins, affects our metabolism. And there's actually a wealth of research data and actually human randomized, interesting little studies, not just poor diet for 20 years leads to cancer and heart disease. We know that. But poor diet for the next 7 hours, what does it do to our physiology? And it's quite instructive, and it's doesn't mean, again, in Memorial Weekend or July 4th, you can't once in a while let loose a little bit. But you'd be wise to let loose. You're going to have some barbecued hot dogs, have a salad, have some broccoli, balance it. That's what I was going to say. This study on high saturated fat meals and endothelial disruption, dysfunction for a few hours. when they did the same meal with a salad, it almost totally neutralized the malfunction, because there's your antioxidants, there's your anti-inflammatory components. Even acutely, you can plan a logical, healthy diet, even when you want to have a little fun.
I love that. Do you think that there's a component with the gut microbiome and the fiber in the salad, the short chain fatty acids actually modulating the immune response and kind of shutting down that inflammation as well?
Yeah, I think that's likely. It's been questioned, how can those studies show endothelial function dysfunction within an hour, when it takes longer for the food to get in our colon, which is where the bulk of the bacteria are. And if it is actually bacterial endotoxin being released, wouldn't it be 6-7 hours later that burger or that hunk of cheese or that milkshake, these are sometimes the foods that are used, demonstrates a release of endotoxin? Well, it turns out the McDonald's sausage patty is full of endotoxin. It's dead meat that has bacteria on it that have preformed endotoxin. So it actually, the food you eat may carry the toxin with it. Even it's a dead toxin. It's not causing, cholera or C. difficile infection, but it has a toxin in it. That's why within an hour of eating it, it has crossed the small intestine border and gotten in. But absolutely, it ultimately gets to the colon, and it can disrupt the microbiome. So you're impaired in terms of short chain fatty acids. And there's a very different microbiome in people that eat of a poor quality diet versus a high quality diet. If I just tell you, coolest study, I think, in the last 5 years, Stephen O'Keefe, University of Pittsburgh, took people in inner city New Orleans, I think it was, eating a pretty poor quality processed diet by the nature of their economics and location, and found a similar population in South Africa eating in the bush of a native, very plant, rudimentary, root-based diet. And they switched their diets for 2 weeks. They brought the food to New Orleans and the New Orleans to South Africa. And they did the most extensive microbiome and proteomics and metabolomics and endotoxins. And within 2 weeks, you can completely upgrade your microbiome and you can completely downgrade your microbiome. So this is a very living culture of bacteria that respond to many things, but respond to our food choices very rapidly and very dramatically.
So what I'm hearing from you, Dr. Kahn, is that there's an intimate relationship between our gut health and our cardiovascular health. And so if you want to, everyone's talking about gut health, very trendy. Everyone's talking about how you got to nurture that inner garden. And if you want good cardiovascular health, you got to be thinking about your gut health in general.
Right. And it's been absolutely bullseye. We're totally aligned there. It's been difficult to measure, and it's still difficult to measure. There is an interesting chemical metabolite called TMAO, trimethylamine anoxide. And if you go to a Quest lab now, you can ask for that to be drawn from your primary care doc or your functional doc or whatever. And we do know that a carnitine-rich meal, which is typically red meat, or a choline-rich meal like egg yolk, can lead to rapid production by the gut bacteria lining and enzymes in our gut wall of TMAO. And it may be bad for arteries and for our kidney function and cause scarring in our organs. That's right now probably the best measurable example of gut-heart connection. I mean, I think we'll get better at measuring this. I can't order easily endotoxin levels on my patients. I can resort to high sensitivity C-reactive protein.
Yeah. So I think just to recap that too, for those that may not have followed that. So the type of bacteria you have in your gut can actually break down, metabolize that carnitine and the choline found more highly in animal-based foods and can produce this compound called TMAO that can lead to more of this inflammatory picture. And so I do think, and because I kind of looked at some of these studies too and always kind of thought like, wouldn't that be really dependent on the type of bacteria in the gut? And if in the context of a wholesome plant-based diet with a lot of, phytochemicals and a lot of fiber, and you're getting a lot of those short chain fatty acids, is that going to change the response in terms of how much TMAO you're eating if you are eating choline-rich and carnitine-rich foods in the context, again, of a more wholesome plant-based diet?
Yeah, undoubtedly, yes, and actually proven yes. If you find a person with a high TMAO level, I actually say humbly, I think I've drawn more TMAO levels than any physician in the United States. I've just been part of my panel for 5 years now. And you switch them from a Western diet to a Mediterranean diet, which advises lowering red meat, replacing it with fish, eating more fruits and vegetables and grains. You act and extra virgin olive oil, because extra virgin olive oil may also blunt or block TMAO production. You can see TMAO fall with an upgrade in diet. And secondly, there's these famous studies at the Cleveland Clinic where they took vegan vegetarians eating lots of plants. They got them to eat an 8-ounce steak rich in carnitine, and they made almost no TMAO. These were acute studies, one-day studies. But yes, always, as I would say, any meal with broccoli, salad, sweet potato, purple cabbage, red bell peppers, it's a better meal. Even if it's next to a pizza, it's a better meal.
Yeah, and I think everything that you've been mentioning too, antioxidants, polyphenols, color, and I think we can get on the same page that it's really encouraging people to approach more whole food and less of that highly refined processed foods, and incorporating more plants, more plant diversity, and getting more of that color in that comes from those phytochemicals. Because it's going to support that endothelial function. It's going to lower inflammation. And again, those antioxidants have these beneficial, they benefit us as humans because they help kind of mop up that oxidative stress that can lead to this more inflammatory picture.
Absolutely. I'm a big fan, I'm sure you do, of some of these bitter foods and all that. We have that response called hormesis, what doesn't kill you makes you stronger, and eating your arugula and eating your bitter melon, and even the bitter in extra virgin olive oil has the bitter comes from a compound called oleocanthal. Been reading about it. It's fascinating. But
yeah,
Petri dishes, it's like suppressing cancer cell growth and reversing insulin resistance and improving endothelial function. I think we're just starting to learn some of these compounds, but these bitter taste, that burning in your mouth, is usually a good sign that you're going to get an antioxidant response and a anti-inflammatory response from the meal you're eating.
And we usually are focusing on the macronutrients. We even think about micronutrients to a lesser degree, but I really think we should be thinking about how many of these polyphenols and antioxidants can we get into our diet, and thinking of those as a micronutrient in a way. So, I just think the more diversity of plants you can get into your diet, the better. Not only how that's going to support your gut health, but how that's going to support your cardiometabolic health, and how it's going to enhance a more robust immune system as well. I wanted to change gears a little bit and just talk about a little bit exercise. I mean, exercise, movement, for most of us, it's free. We need to move. How is exercise so important for that overall endothelial function and cardiovascular health in general?
Well, I mean, 100% alignment. Again, just in the last 2 weeks, a study, I'm blanking if it was from Duke, but measuring your MVO2, a measure of your oxygen uptake during submaximal exercise. One of the strongest predictors of survival is being fit, being able to achieve not necessarily superhuman levels, but consistently good fitness. It's absolutely important. We don't have to run marathons. We don't have to do triathlons. If you love it, go ahead and do it. But we do need to, stress ourselves, get our blood pressure up, get our heart rate up, cause some hormesis, cause some stress. And then for the other 23 hours in the day, or 23 and a half hours in the day, whatever amount of time you've got left, you're going to see a lot of restorative and rejuvenative properties. The power of exercise, manage and return blood pressure to normal, lower C-reactive protein, probably by altering visceral fat distribution and lowering visceral fat distribution, raising testosterone, certainly weight loss and hormonal balance. And just on and on. Certainly cholesterol, changing particle size and balance from more of a metabolic syndrome to a more normal pattern. I mean, and I'm a big fan every day. I get something done, but I balance weights and I balance cardio and I balance some flexibility and yoga kind of style in it all, because you want to go for the long run. You don't want to injure yourself necessarily. Yeah. People can do CrossFit, but then this one got hurt and that one's out. And if you love it, again, do it if you love it, but just make sure you don't injure yourself in the process. I'm trying to think of any other profound comment on, fitness as, again, it's a perfect hormetic kind of stress. We do some injury, and then you let the repair happen, and ends up being a better person at the end of that.
Can you speak to, or is it just like a balance when it comes to aerobic based exercise versus like high intensity interval training and some more resistance weight training? Have we seen either one be more favorable for just more robust cardiovascular health?
Yeah, when you talk metabolic syndrome, triglycerides, HDL, weight, blood pressure, it does look like high intensity interval training is just a more efficient and maybe more effective way than, you know, there's a lot of good ways to exercise. Majority of people, when we used to go to health clubs, there's Men's Health or whatever other, and it looks like a rather sad sack exercise without much sweat coming down the brow. I mean, that's the one good thing about high intensity interval training. It's more time efficient, and it tends to achieve higher heart rates, higher blood pressures transiently. And I'm a big fan of using it. There's actually some, again, brand new data. If you've got a desk job and you're sitting, every 15 minutes, if you go down and do like 5 burpees, that's all it is. 5 burpees, go back to your desk. It's like 5 seconds of a burst of intense exercise. You can actually measure more favorable lipid particles and blood sugar levels and postprandial levels. It isn't always 3 hours to get packed for the gym and spend time at the gym and come home and shower. It's literally, I'm at a standing desk, which I spend most of my day standing, or bouncing around, or taking lunch break up and down some stairs. Never miss an opportunity to just burst, get your heart rate up, and go back to what you're doing.
Yeah, make time, and it's just the little things I think that are going to add up in terms of the long-term results. So that was awesome. So just to kind of recap, foundational, we were talking about diets and really kind of doing this plant-forward approach, rich in fiber and antioxidants and polyphenols, thinking about color and whole foods. You talked about exercise and movement and kind of getting the best of both aerobic and, sweating and resistance training. You talked about sleep briefly and just the importance of getting quality sleep. And so, just in interest of time, I know we're wrapping up, but I was curious if maybe you could just talk briefly about maybe 2 or 3 nutraceuticals or supplements that are intriguing to you. Maybe you use it a lot in your practice and or, from the literature tend to, benefit a lot of cardiovascular health.
Yeah, so that's easy. And these are non-promotional statements. These are my companies. I'm fascinated by an Italian citrus called Bergamot. You see it in Earl Grey tea. You see it in some facial lotions. But you can buy a tablet that is from southern Italy. It looks like a citrus, looks like a lemon. It is a citrus. It's a bergamot citrus. Studies in southern Italy for about 30 years show in humans metabolic syndrome, antidote, lowers cholesterol, lowers blood sugar, lowers C-reactive protein, improves endothelial function. It's the most non-toxic tablet and fairly inexpensive. I don't really see bergamot powders. I see bergamot as a capsule. So I've used that over and over and very impressed with it. And you can't just go buy a bergamot at the local produce department. So it's usually a capsule. This is my secret. I never tell this. Ooh. But Artero Protect, made by a company in Fort Lauderdale called Life Extension, is 2 herbs in a vegetarian capsule. One herb is pycnogenol. Pycnogenol comes from the bark of a French maritime pine tree. And another herb called gotu kola, or also known as centella. But they're very powerful antioxidants. We've been talking a lot about that. And they're not what you're going to find in food because of where they're sourced. And there are now 6 studies that if you have plaque in your carotids, and 1 study if you have plaque in your heart arteries, and you're on this puppy or placebo, these are done at a university in Italy with very high standards. This is a very powerful reversal agent. It's exciting to say, and I see that in my patients consistently. Inexpensive, non-toxic, very safe, no drug interactions. So bergamot, pycnogenol, gotu kola.
Those are going to enhance cerebrovascular blood flow. Is that right?
That hasn't been studied. I suspect it would. It actually diminishes plaque burden. So based on just hemodynamics. The last one, and I think I have a bottle. Yeah, I do. I'm a crazy fan of aged garlic. Interestingly, very widely used in Japan in heart patients. There's a difference between just a garlic bulb and aged garlic. As it sits there, it concentrates some of the, many active allicin family polyphenols and such. But there's, again, a series of studies from UCLA that if you have heart plaque and you take aged garlic daily, you can actually measure heart plaque going down on follow-up studies. So, heart docs don't talk about that. And this is peer-reviewed, UCLA-based science in humans. So those are, some of the secret little puppies I pull out before I'm necessarily going to go to, because even the pharmacologic agents, prescription agents, don't have that kind of data. I mean, cardiologists don't talk about plaque reversal, yet this literature has been around for at least a decade. So very exciting little agents.
Amazing. Well, you heard the secrets right there from a cardiologist. Well, Dr. Kahn, thank you so much for your time. This was a very engaging and informational discussion. And I know a lot of people are going to get a lot of benefit out of it, feel empowered, and take action on many of those different lifestyle-based factors you talked about when it comes to preventing cardiovascular disease risk. So thank you for your time. I wanted to open it up. I know you just came out with a new book, Lipoprotein A.
Everything's within a reach just because it's a small.
There you go.
But, we mentioned this, and I mean, this is an inexpensive book on Amazon, but lipoprotein little a, you can see there the lowercase a, is the most common inherited cholesterol disorder in the world. There's about 1.8 billion people walking around with a high level of this LDL-like particle, but it doesn't show up on any standard blood test. You should know if you inherited this. Ask your doctor, please check my lipoprotein little a. You're welcome to buy the book because there's, about 50 or 60 great recipes in here.
Amazing.
Because there is a plant-based diet approach to lowering it. There may also be a COVID-19 connection. These tragic young people getting strokes and clots. It may relate because lipoprotein little a also promotes blood clotting, and nobody's measuring it in the ICUs. Nick Cordero, the Broadway actor who's out in LA right now trying to struggle through a horrific, COVID-19 clotting illness, and his wife, Amanda Klutz, posts on Instagram all the time. These just compelling stories. That may be the connection for people like that. So lipoprotein little a, the heart's quiet killer.
Amazing. Yeah, I just got an advanced blood work lab for lipids, and I was low risk for LP little a, and I was excited.
Good. You only got to do it once.
Yeah.
Your parents are good people.
For those that want to find you, connect with you, where do you hang out most? For those that want to.
I'm all the social media channels, but if you go to my website, drjoelkahn.com, drjoelkahn.com, Twitter, Instagram, YouTube, Facebook, my clinic. I own a restaurant in Detroit, plant-based restaurant, all kinds of
amazing,
crazy activities going on.
Very good. Well, thank you so much for your time, Dr. Kahn. It was a pleasure speaking with you. And I know so many people are going to get a lot of value from everything that we discussed today. So
keep doing what you're doing because you've got the word out there, and I love what your message is. So thank you.
Thank you so much. Well, so stay safe, stay healthy, and we'll chat soon.
You bet. Peace.
All right.